Hello, my name is Lynn Portis. I currently attend MUW. I'm a student in the BSN program. Recently, we have been studying the national opioid crisis. The United States is in the midst of a devastating opioid misuse epidemic, leading to nearly 33,000 deaths per year related to both prescription and illegal opioids. The opioid crisis is defined as a national emergency and an epidemic in the United States. Emergency system resources are further taxed and drained by the increased 911 calls for overdose incidents. This means that instead of responders dealing with heart attacks, stroke patients, or other emergencies, the first responders are using a great bit of time dealing with patients and stabilizing them from opioid overdose. This resource drains spreads to hospitals and emergency rooms as they treat these patients. Eventually, the epidemic results in higher insurance costs to cover the medical resources. Pain management is important for patients. It becomes challenging for patients when their pain is not treated. Opioids can cause a patient to become depressed as well because of the pain and opioid misusage. It is highly likely that if patients or people only using opioids to control their pain will develop a tolerance and require higher doses of pain medication that will eventually lead them to opioid addiction. One can find that they are on the verge of opioid addiction when they have, when they're not using a pain medication that follows the doctor's prescription, using the medication to get high or anxiety relief, requiring higher doses in order to feel the same effect that they're used to. When you're addicted when you are turning to snorting or injecting drugs. When you spend a great deal of time and effort to obtain the drug, that's also when you become addicted. If patients practice using other alternatives, they may find that they don't have to use opioids to relieve their pain. Those other alternatives are, but not limited to, cold and heat therapy, exercise, physical therapy, occupational therapy, music therapy, therapeutic massages. Common side effects of opioid administration includes sedation, dizziness, nausea, vomiting, constipation, physical dependence, tolerance, and respiratory depression. Fatal arrhythmias are also a potential side effects for some patients. When using opioids, you need to use it if you have pain that is not controlled. You can use over-the-counter medications or other non-opioid prescription to alleviate pain. As your pain get better, wait a longer time in between taking the opioids. Never mix opioids with alcohol or other medications. If you feel that you are at risk or are dependent on opioids and have an addiction, there are resources available to help overcome the addiction. There are hotlines. You can talk to your counselor. When you go to the hospital, you can address it then, and there are social workers to guide you. Never take opioids from anybody never give you opioids to anybody because it is illegal to take opioids without a prescription. Together, we all can help combat this crisis on national opioids. Thank you.